Check your state laws and facility policy to make sure you are permitted to perform this procedure. Before giving nail and foot care, check the care plan or the nurse's instructions. Note any restrictions or special considerations. Before you begin, practice hand hygiene. Identify the patient and make sure that privacy has been provided. Follow all additional instructions in the preparation section of this program.
Good morning, ma'am. My name is Ellie. I'll be your nurse assistant today.
Hello.
Hello. What's your name?
Carolyn Baker,
And what's your birth date?
9/6/53.
Okay. Okay, I've got all my...
To help prepare for giving nail and foot care, assist the person to the bedside chair. Remove her footwear and socks or stockings. Then place the bath mat under her feet. Make sure the call light is within reach. Perform hand hygiene. Fill the wash basin or whirlpool foot bath 2/3 full with water. The nurse tells you what water temperature to use. Measure the temperature according to agency policy, such as with a bath thermometer.
All right, Miss Baker, you want to test this water for me and see how that feels?
Also ask the person to check the water. If needed, adjust its temperature. Then put the basin or foot bath on the bath mat. After putting on gloves, help the person put her bare feet into the basin or foot bath. Make sure that both feet are completely covered by the water. Fill the kidney basin 2/3 full with water. Measure the temperature according to agency policy. After you've asked the person to check the water temperature, place the kidney basin on the overbed table and move the table in front of the person. Place the person's fingers into it. Position her arms for comfort. Let her fingers soak for 5 to 10 minutes, and let her feet soak for 15 to 20 minutes. Rewarm the water as needed.
Okay, now that your hands have soaked, I'm going to go ahead and start your nail care.
All right.
When the person is done soaking, remove her hands from the kidney basin. Then clean under her fingernails with an orange wood stick, wiping it with the towel after each nail. After cleaning under all the nails, thoroughly dry the hands and between the fingers. Now clip the fingernails straight across with nail clippers.
Your son came to see you.
Yes, he did.
Did you have a good visit?
Yes.
Using an emery board or nail file, shape the nails so that they're smooth with no rough edges. Check each nail for smoothness and file them again as needed. Using an orange wood stick or a washcloth, push the cuticles back.
Okay, I'm going to put some lotion on your hand now.
Then warm the lotion between your hands and apply it to the person's hands. If there is excess lotion, use a towel to remove it.
All right, Ms. Baker, now we're going to start with the feet.
All right.
To continue, move the overbed table to the side and lift one foot out of the water. With one hand, support the person's foot and ankle. With your other hand, use soap and a washcloth to wash the foot. And clean between the toes. Return her foot to the water for rinsing and be sure to rinse well between the toes. In the same way, wash and rinse the person's other foot. Now, remove her feet from the basin or foot bath. Dry them thoroughly, especially between the toes. Be sure to support the person's foot and ankle as needed. Next, warm some lotion or petroleum jelly between your hands. While supporting the foot and ankle, apply the lotion to the tops, soles, and heels of the feet. Don't apply it between the toes. Using a towel, remove any excess lotion or petroleum jelly. After removing and discarding your gloves, practice hand hygiene. Then help the person put on non-skid footwear. Once you've completed nail and foot care, perform post-procedure care. For instance, once you have made sure the patient is comfortable and that the call light is within reach, report and record your observations. For detailed information, see the section on follow-up care, reporting, and recording in this program.